Welcome back to your channel. Today we're diving into a critical topic that affects millions of people worldwide: blood pressure. Whether you've been diagnosed with hypertension or you're simply looking to maintain your health, this video is for you. We'll cover what blood pressure is, why it matters, how to measure it, and most importantly, how to keep it under control. Without further ado, let's get started. Number 1. What is blood pressure? First, let's understand what blood pressure really is. Blood pressure is the force of your blood pushing against the walls of your arteries as your heart pumps it around your body. It's measured in millimeters of mercury, mmHg, and recorded with two numbers, systolic and diastolic. The top number, systolic, represents the pressure in your arteries when your heart beats. The bottom number, diastolic, represents the pressure when your heart is resting between beats. A normal blood pressure reading is around 120/80.
Your heart pumps blood around your body in order to provide your cells with oxygen. This pumping of blood puts pressure on the walls of your blood vessels. This is referred to as blood pressure. Your blood pressure varies as your heart muscle contracts and relaxes, which is why your blood pressure measurement is two numbers, not one. It's higher during contraction and lower between heartbeats. When your numbers get too high, you're increasing your risk of stroke, heart and kidney disease. High blood pressure means your heart is working harder to move blood around your body. If the arteries become narrower, the pressure increases. In the same way you need very high pressure to move water through a blocked hose. But because high blood pressure doesn't usually cause symptoms, many people may not know that they have it until damage has occurred. So get your blood pressure checked. If it's high, talk to your doctor about taking steps to get it under control. And keep an eye on it. If those steps include medicines, stick with it, or it won't protect you.
Number 2. Why is blood pressure important? Maintaining a healthy blood pressure is crucial because high blood pressure or hypertension can lead to severe health problems. It's often called the silent killer because it doesn't always show symptoms but can cause serious damage over time. High blood pressure can increase the risk of heart disease, stroke, kidney damage, and even vision loss. That's why it's vital to keep an eye on your numbers and take action if they're too high.
This is the St. John Providence Heart Report. With us today is Dr. Tom Lalonde, Chief of Cardiology at St. John Hospital. Dr. Lalonde, what are the risks for people who are living with high blood pressure?
Well, plenty of risk. They call high blood pressure the silent killer for very good reason. It causes no symptoms till it's too late, till it affects the heart, the brain, or the kidney, and those are the three organs it targets to cause strokes, heart attacks, and kidney failure, which can even lead to dialysis.
What can people do to control their high blood pressure?
Plenty of things patients can do. Predominantly follow a very good health-conscious diet, common sense diet. We call it the DASH diet, dietary approaches to stop hypertension, which includes fruits, vegetables, low-fat, high-grain, and predominantly low in salt. That's probably most important. And if a patient does have high blood pressure, they need to be very compliant with taking their medications.
Number 3. How to measure blood pressure. You can easily measure your blood pressure at home using a digital monitor. Here's how. Sit quietly for 5 minutes before taking a reading. Make sure your feet are flat on the floor and your arm is supported at heart level. Place the cuff snugly around your upper arm, just above the elbow. Press the start button and relax while your monitor inflates the cuff and takes your reading. Record your numbers and track them over time to spot any trends.
To monitor your blood pressure using an automatic blood pressure machine, sit comfortably for about 5 minutes before taking the measurement. Make sure your back is supported, feet are flat on the floor, legs uncrossed, and roll up your sleeves if needed. Then place your arm on the table, palm upward, even with your heart. Then place the cuff on your arm 1 inch above your elbow pit. Make sure the artery line or the tube falls in front center of your arm. And wrap the cuff around with the appropriate snugness. The cuff should be placed tight enough so that you can fit 2 fingertips at the top end of the cuff. To get started, press start and remain still and quiet as the machine is measuring. The cuff will inflate and slowly deflate to get accurate measurement. When the reading is complete, the machine will display the blood pressure reading and pulse. Record your numbers daily, either by writing it down in a journal or entering it into your phone or laptop.
Number 4. Factors affecting blood pressure. Several factors can influence your blood pressure. Diet plays a significant role. Eating too much salt, for example, can raise your blood pressure. Aim for a balanced diet rich in fruits, vegetables, whole grains, and lean proteins. Limit your sodium intake to less than 2,300 milligrams per day and opt for fresh, unprocessed foods whenever possible. Regular physical activity is another key factor. Aim for at least 150 minutes of moderate exercise per week, such as brisk walking or cycling.
The exact cause of your high blood pressure can be difficult to diagnose. It's a result of the complex interaction between your lifestyle and genetics and other factors which together affect your blood pressure. Regardless of the cause, high blood pressure means your heart is pushing harder to get blood around your body. The bigger push gives your heart and the blood vessels a bit of a workout. As a result, the arteries bulk up, further restricting blood flow and worsening the problem. And it's this increasing pressure on the blood vessels that's the big concern. Eventually, it can cause them to thicken to the point where they become blocked or burst. A burst or blocked artery means blood can't get through. The cells on the other side won't get oxygen and will be damaged. In your brain, this may mean a stroke. In your heart, a heart attack. In your kidneys, wastes and extra fluids are not removed, which has serious heart and health implications. But because high blood pressure doesn't usually cause symptoms, many people may not know that they have it. So get it checked, and with help from your doctor, you can take the necessary steps to get it under control.
Number 5. Tips for managing blood pressure. Now let's talk about some practical tips to help manage your blood pressure. First, maintain a healthy weight. Losing even a small amount of weight can significantly lower your blood pressure. Second, manage stress through relaxation techniques like deep breathing, meditation, or yoga. Third, limit alcohol consumption and quit smoking. Both can negatively impact your blood pressure. Finally, monitor your blood pressure regularly and follow your doctor's advice. If medication is prescribed, take it as directed and discuss any side effects with your healthcare provider.
Hypertension first is an asymptomatic disease, so you won't know that you have it unless you check your blood pressure levels. And so the other reason is that it's a very important risk factor for stroke in particular and for heart disease as well. So elevated levels of blood pressure do contribute significantly to both the incidence and mortality from both of those diseases. When your blood pressure is high, it's adding increased stress into your vascular system, your blood vessels, and your brain, and your heart, and your legs, and your arms. So it's increasing the pressure in your system, which increases the atherosclerosis, that is the plaque development in your arteries. There are many ways that you can prevent high blood pressure from developing, or if you have high blood pressure, to maintain it and control it. So first and foremost, you need to eat a healthy diet. That's a diet rich in fruits and vegetables, low in sodium, and rich in whole grains. Secondly, you can exercise. Exercise actually reduces your blood pressure level. Most importantly, you need to maintain a healthy body weight. That means your weight over height needs to be below an index called the body mass index of 25 kilograms per meter squared.
Understanding and managing your blood pressure is a vital part of maintaining your overall health. By making simple lifestyle changes and staying informed, you can keep your blood pressure in check and reduce the risk of serious health issues. Thanks for watching. If you found this video helpful, don't forget to like, share, and subscribe for more health tips. Stay healthy and take care.